Imagine being strapped into a cold iron device as punishment for something your body does naturally. No trial, no crime, just a midnight urge. In the 1800s, masturbation wasn't just taboo, it was a medical emergency and a moral panic. Doctors prescribed brutal contraptions. Parents paid to have their children fixed. Entire institutions were built around a single goal: to eliminate desire. Welcome to another deeply disturbing episode of Forbidden Realms, the series where history's strangest shadows come crawling back to life. Today, we're diving into one of the most bizarre chapters of human control. When pleasure itself was punished with pain, the roots of this madness begin in the late 1700s. But by the 19th century, religious groups claimed self-pleasure corrupted the soul. But medicine took it further, warning that touching yourself could cause blindness, cancer, memory loss, epilepsy, and even early death. Doctors wrote entire books detailing how masturbation destroyed the nervous system. One of the most infamous was Onania, a widely circulated pamphlet that sparked widespread fear and fueled parental anxiety. One of the earliest and most terrifying devices was the anti-masturbation ring. Usually made of brass or iron, it was placed around the penis and fitted with inward-facing spikes. Any sign of an erection would drive the spikes into the skin. Some were connected to bells or wires that rang if the child moved during sleep. This wasn't an obscure practice. It was endorsed by doctors and sold in catalogs. Imagine being 14, locked into pain every time your body responds the way it was designed to. Chastity belts weren't only for women in medieval myths. In the Victorian era, both boys and girls were forced into them. For boys, heavy leather belts with metal shielding and padlocks. For girls, metal girdles that pressed tightly against the genitals, sometimes with jagged linings to prevent penetration, even accidental. Some belts were worn for months at a time. They left bruises, infections, and deep psychological trauma. And parents were told this was love, discipline, morality. Women and girls faced especially horrific treatments. In the mid-1800s, some doctors performed clitoridectomies, surgical removal of the clitoris, to prevent masturbation and hysteria. No anesthesia, no consent. These were often teenage girls diagnosed with being too emotional or willful. Some had only been caught reading romance novels in bed. And worse, many of these procedures were considered successful by physicians of the time. By the late 1800s, asylums had begun experimenting with more invasive methods. Electric shock therapy was used on genitals to cause aversion to arousal. In other cases, doctors used cauterization, burning the genitals with heated metal rods. One report describes a young man having his scrotum burned repeatedly after being caught pleasuring himself in the lavatory. These were not rogue punishments, they were documented clinical practices. Enter Dr. John Harvey Kellogg, the man behind cornflake. He believed that bland food could suppress sexual urges. Kellogg never consummated his own marriage. He separated bedrooms from his wife and claimed all sexual desire was a disease. He pushed cornflakes as a remedy to cool the passions, but his other remedies were far more grotesque. He advocated for acid treatments on female genitals, circumcision without painkillers, daily enemas for boys caught masturbating. Yes, the same man celebrated on cereal boxes. The restraint suit looked like something from a horror movie. A full-body straitjacket designed for children, arms and legs bound, sometimes even a mouthpiece to prevent tongue movement. The goal: immobilize the child during sleep, preventing any nocturnal stimulation. Some suits were locked on with keys only the parents had. In extreme cases, restraints were worn during school, meals, even church. In rare cases, the victims spoke out later in life. One man described his childhood like a prison. My hands were tied to my bedposts. My father told me I'd go blind if I disobeyed. Another woman recalled her mother checking her sheets every morning for signs of arousal. If anything looked suspicious, she'd be whipped. These aren't isolated stories. They were common in upper-class families, religious households, and elite boarding schools. In asylums, masturbation was both a symptom and a cause of madness. If you were caught doing it, you could be institutionalized. And once inside, the rules were gone. Ice baths, isolation for weeks, genital stitching. One girl, age 15, was sewn shut under the guise of moral surgery. She never left the institution again. The punishment didn't fit the crime, because there was never a crime. By the early 20th century, attitudes slowly began to shift. Sexologists like Alfred Kinsey and Sigmund Freud challenged moral fear with scientific curiosity. They exposed the dangers of repression, the cruelty of denial. But make no mistake, the ghost of Victorian shame still lingers. In purity pledges, in abstinence-only education, in subtle social punishments for pleasure, the tools may have changed, but the ideology hasn't entirely vanished. So next time you hear someone long for the good old days, ask them, do you mean the days of iron belts and mutilation? The days when children were tortured for being human? History isn't always glorious. Sometimes, it's monstrous. This has been another journey into the darkness with Forbidden Realms. Subscribe for more disturbing truths from the corners they never teach in school. Until next time, stay curious and stay cautious, because the past has claws.